All right, guys. Thank you so much for joining me today. Whether you're on the live or you're on the replay, this is Gut Over It. My name is Dr. Vivian Asamoah. I'm a gastroenterologist and functional medicine provider in Katy, Texas. And I just put myself on this crazy challenge to go live for 30 days. And so every day in February, I would love to present a GI topic. So something that is what I think is important things that our patients should be sharing with their GI docs, but sometimes feel too embarrassed to share. So it's going to be 30 days, rain or shine. Please, please bear with me, join me, like me on Facebook, comment, let me know if there are topics that you want to hear about. And I'm really excited and looking forward to this. I haven't done a lot of lives, so it took me a while to figure things out. My camera was not working, so just bear with me. And I hope my computer doesn't die, so hopefully everything goes well. I want to talk about the gut, the mouth, anything that has to do with the mouth and how it affects the rest of the gut. So my plan was to basically over the next 30 days, start from mouth and work myself down to kind of anus. Anything that's GI related. I'm also looking for interesting topics in gastroenterology. So today I want to talk about the oral, the mouth, the teeth, the tongue, the gums, and how it connects to or could possibly be related to gut disease. So let me just make sure, let me just check with my peeps, my people, just to make sure they're hearing everything okay. I want to make sure that everyone can hear me. So if you could just put a like in or put a comment in whether you can hear me, that would be great. Okay, so that I'm not talking like to no one out there. Can you hear me? So I'd love to get some comments and some feedback from you guys if you can hear me. I just want to be sure. All right. Yay, Landa. Thank you. Somebody's out there. You can tell this is my first time, right? Thank you. Okay, awesome. So let me double check one more thing. Let me make sure that my computer is fully charged, okay? Because I would hate for this to die out on everybody. All right, 1 second. I'm gonna ask my husband to check and get me a charger, just to make sure this computer doesn't die on me. All right. So as I was preparing this, I did a little preparation and I wanted to talk about the mouth and how it relates to the gut. I came across somebody called Joy Milne. I think her name is Milne. Very, very interesting person because she, in actual fact, has a special gift. When we talk about bad breath, she has a superhuman gift where she can actually detect cancer, Alzheimer's, and Parkinson's disease just by smelling people's breath. Now, if you think this is weird, please type in the comments gut over it because I thought this was very strange. So she is actually from Scotland. She's a Scottish nurse and she was married to a doctor for years. I don't know if anyone else has heard about this, but through his breath and his smell and the changes in his breath, she could actually detect a diagnosis of Parkinson's disease 10 years before the official diagnosis was made. So if you think this is weird, please type in the comments gut over it because I was completely fascinated by that. So she's actually been, they work with her in different parts of the world. She does a lot of research trials, and she is able to detect almost 99% by smelling someone's breath whether they have some kind of disease. And so usually it's cancer, it's Alzheimer's or Parkinson's. And this is really interesting because it just tells us so much about how the gut microbiome is really connected to the entire rest of the body. So when we talk about bad breath, we often think about, could it be gum disease? Have you seen your dentist? But in doing the research, I actually saw that bad breath can be associated not only with cancers and things that are rare, of course, if you're superhuman, but can be associated with diabetes, like finding a new diagnosis of diabetes, um, H. pylori, so a bacterial infection in the stomach, GERD. It can also be associated with, of course, any kind of dysbiosis or bacterial overgrowth in your system. So that's really, really, I mean, a lot of people will don't often make the connection and think it's just because they're not brushing well, but it goes really deeper down into the gut where these hydrogen and hydrogen sulfide and methane is being released and causing this bad breath. So I thought that was actually really interesting. And another thing that I learned that I think is important to talk to your doctor about, your GI doctor about, is if you have any gum disease, any gum lesions. Thanks, honey. Any gum disease, any gum lesions, because that could be a sign of diseases like celiac disease, where you're not absorbing well, could be a sign of Crohn's disease. It could be a sign of even just heart reflux, reflux disease, acid reflux. Could also be a sign of sometimes we actually get into some vitamin deficiencies as a result of gum issues as a result of vitamin deficiencies, like vitamin C that we know causes scurvy, vitamin A, vitamin E. So micronutrient deficiencies can also cause gum issues and mouth issues. Okay, but that's actually pretty interesting. If y'all have any questions for me, please put it in the comments section. Any questions about how the mouth, gum, teeth can be associated with gut disease, please definitely put it in the comments section so I can help answer some of these questions. But it just makes me realize how important it is when you guys go see us as GI doctors or even your general practitioners. Let them know if you've got anything going on in the mouth. Canker sores can often be linked to Crohn's disease. And I see a lot of people referred by dentists who actually pick up on cavities, enamel erosion from reflux disease. So they'll be going for their cleaning and they'll notice that this person is having a lot of cavities or dental erosions. And very often the first question the dentist will ask is this actually related to something going on inside the gut? So it's important to tell your GI doc because we don't always talk to the dentist, but sometimes word gets around and we hear about things like that. Something else that's really important to look for or tell your doctor about is if you've got any issues with your tongue, right? So if you've got any kind of issues with your tongue. So sometimes we will notice that someone has a beefy red tongue, like really, really red and beefy and like larger than usual. And that in itself can also be a sign of micronutrient deficiency. So vitamin B, niacin, folate, all of that can create that beefy red tongue. There's also something that I have seen recently called a geographical tongue. It's almost like your tongue has like a map on it, like an outline of a map on it. So I know some people are born this way and they just have it, but I also notice that people develop it over time. So this could be related to, we see this a lot in autoimmune disease. So people with Sjogren's disease, we'll sometimes see this in people with Crohn's or other autoimmune stuff like Hashimoto's disease. And I've actually seen when you put them on the right diet, When you take away nightshades, you do an elimination diet, this gets better. So, I mean, I think that's really, really interesting how just even the tongue can be associated with systemic issues. So, if you think this is interesting, please go ahead and type in the comments, gut over it, or hit some likes in the comments. So I know that you guys are finding this interesting. I really want this to be interactive. I want to hear if you guys have any comments. I know some of my patients are listening. Some of our staff are listening. So if you have any questions or comments, let me know. Thinking a little bit more about how the mouth relates to the gut. This one. So the white tongue. So when people say, you know, I can't brush, I feel like I have a white coating over my tongue and I can't brush it off, that's a sign of candida. That usually is a sign of candida. And a lot of the times when there's candida in the mouth, there is candida in the gut. So it's a good first place to start, but it usually means that there's systemic candida all over. And so sometimes just treating the mouth isn't good enough. We have to treat the rest of the body. And the way we treat candida is, as we do in a lot of things in gastroenterology, diet. Kind of changing the diet, getting rid of sugar, and seeing whether, you know, that helps. And then sometimes we'll put our patients on anti-candida medications like nystatin. I usually like to go with herbal antifungals because you can keep it on for longer and it works for much longer. So if you're finding this interesting, please ask some questions, like us. I really want to hear some feedback because I'm trying to do this. The whole purpose of doing this is to try and, I had to do research, so I'm educating myself, but also providing some kind of edutainment for my patients and everyone out there, making sure that you are communicating all that you need to talk about with your GI doctor or your primary care provider when you see them. And that your GI doctor is also making the connections, right, between, you're complaining of these symptoms. I don't think it should be brushed away, right? If you're complaining of these symptoms and they do the research, they definitely have to see that, yes, this could be connected to something going on inside the gut and we should check. So if anyone has any questions, please shoot me a question. Oh, it's great to see there's so many people on. That's really exciting. If you all have any questions, please let me know. I definitely want to hear and answer. I got a question about celiac disease and gut disease and oral manifestation. Yes, there's definitely an association. And I think it's because with celiac disease, you'll see iron deficiency. So iron is low, which can cause, beefy red tongues. You'll sometimes see allergic type phenomenon. So you'll see that what we call the contact dermatitis on the sides of the lips, sort of the little folds here. We'll sometimes see vitamin B deficiency with celiac. So celiac causes all sorts of malabsorption. And sometimes the first sign is basically stuff that's going on in the gums and on the tongue. I want to talk about the microbiome a little bit because this is really interesting. We talk a lot about the gut microbiome, and we're realizing how important the oral microbiome is. And so there's actually one study that showed that men who have gum disease and who have had it for a long time, gingivitis and periodontitis, 63% of them actually go on to developing pancreas. So actually the study shows that in 63% of patients who have pancreatic cancer, a lot of them started off with gum disease. So there's this connection with the oral microbiome being off, like dysbiosis and just being completely off. We know that usually leads to inflammation. And we know that inflammation drives a lot of cancers. I thought that was a really important study, right? That there's that connection between the oral microbiome, chronic inflammation, and cancer. So that was also really, really interesting. So I hope that through these discussions, we can share good information. I'd love to get as much feedback as possible from you all to let me know what you want to hear from from a GI doc, questions that you may have from your GI doc. And my goal is to, as I said, work my way down. So I'm going to be starting at the mouth. And tomorrow, I'm going to get it together. We will start on time. I'm going to start talking about globus pallidus, which we're going down to the throat. So globus pallidus is a sensation people get like when they're clearing their throat all the time, and we're not really sure whether it's related to allergies or reflux disease. So I'll just work my way down every day this month, rain or shine, weekend or no weekend, just to provide some edutainment, some education to patients, and also learn just the people out there, so that if you have a symptom that you're not sure about, and maybe you'll hear something on this live stream or on the replay, if you replay it later, that may be helpful information to you to share with your doctor. Go ahead and do so. Don't hesitate, and don't think about it twice. Anything you notice, because you know your body better, go ahead and share it. So again, my name is Dr. Vivian Asamoah. I'm a gastroenterologist in Katy, Texas. I have been in practice for about 10 years, and my practice is really heavily built on the foundations of just good medicine, focusing on nutrition, how to use food as medicine, and incorporating a lot of functional medicine into our care of patients. We are about to launch our Facebook group called Natural Gut Relief, where we'll be providing a lot of great information to share with our patients who are in our functional medicine program. And so one of my goals as a gastroenterologist today, just kind of seeing the science that's out there, the amount of research that's going on in terms of food and natural medicine. One of my goals is really to help people who have chronic gut illnesses, who have gone through a lot of conventional diagnostic testing, conventional treatment, really help them figure out what the root cause of their issue is and help them enjoy eating food again. All right, so again, check us out on Facebook, like us on Facebook, visit our website, www.drasamoah.com, and we're here in Katy. It's a really nice first day. This is going to get better, so I hope to see you guys soon. Bye-bye.